So, I hope that you are all well. English is not my first language, so please bear with me. I'm Victoria Klishko. I'm from Moscow, from Russia. I'm dermatologist, cosmetologist, anti-age expert, founder and ideologist of Institute Clinic. My clinic was founded in 2020, and it's located in the heart of Moscow. And truly I would be delighted to introduce you to my wonderful team. I have a big team, so I'm privileged to have 10 specialized doctors and 6 aesthetic professionals, including dermatologicals, cosmetologists, anti-age therapists, endocrinologists, physiotherapists, spa therapists, facialists. On this screen, you can see part selection of equipments and technology which I have in my clinic. And also, it's like fractional laser, hybrid laser, phototherapy, focus on ultrasound technology, high-frequency microneedling technology, and other. And of course, we utilize a lot of injection in our clinic, like fillers, Botox, Radius, Sculptra, native collagen, a lot of injection. And before encountering nitrogen plasma therapy, I thought that my clinic already had all necessary devices and technology in order to achieve incredible result. But I discovered the brilliance of NeoGen in December 2022, and we have been offering NeoGen at Institute since February 2023. And we have already performed over 3,000 procedures of NeoGen. For example, in 2023, it was nearly 600 treatments. In 2024, nearly 1,500 treatments. And in 2025, we already performed more than 1,500 treatments. Thank you so much. So it's nearly 4 treatments per day. You see how many equipments and equipments and technology I have. But every day we performed nearly 4 or 5 treatments of NeoGen. And of course, I with my team, we have even conducted independent research in multiple skin disease. My favorite is dermatological cases. I treat a lot of rosacea, acne, psoriasis, eczema, atopic dermatitis, and other. And we also instruct and teach other Russian doctors. And I'm supporter and promoter of many NeoGen practices, and I'm a public speaker on conferences and dermatology and aesthetic conferences in Russia. And here you can see some of previous photos from some of previous business conferences and dermatology conferences. So, what do we know? Or actually, what don't we know about NeoGen? This is the main big question was for me when I met this equipment first time. Before I demonstrate my clinical cases, I'd like to remind you about the magical power hidden inside in NeoGen. We already know that NeoGen produce nitrogen monoxide in a plasma state, which is a fourth state of matters. And we actually know that nitrogen monoxide in NeoGen is a partial ionized gas with a high kinetic energy. This information was important for me because this high kinetic energy show us a perfect result, wonderful result when we talk about rejuvenation of the skin. And every time I use wet technique. And when I would tell you about dermatological cases, you should remember, but we talk about monoxide, nitrogen monoxide, and we talk about another molecules like hydroxy radical and peroxynitrate. And what do we know actually about nitric monoxide? I hope that everyone read this journal, because in 1992 nitric oxide was named Molecule of the Year by the journal Science, highlighting its crucial role in biology and medicine. Later, you know that in 1998, 3 scientists were awarded a Nobel Prize. And just look how interest of nitric oxide was skyrocketed since 1986. So, I love this phrase that nitric monoxide, the signaling molecule, because it's a signaling molecule which involved in a various physiological and pathological process in a human body. And you know the changing, what's the difference between the sizes of nitric monoxide and exosomes. And we talk about it in our chat. It's a reason that nitric monoxide we can find everywhere in our body, in every cells. It controls everything. We know that it's a short-lived gas, free radical gas, which plays a crucial role in vasodilatation, neurotransmission, and immune response. And nitric monoxide molecules were found in the cells in a vascular bed, liver, gastrointestinal tract, nervous, and of course in the skin. And we know that we have 2 ways to get a nitric monoxide. One of these way, it's a enzymatic pathway from the amino acid L-arginine, and it's inside our body. And this happens with the help of 3 enzymes called nitric oxide synthase: neural, endothelial, and inducible. It's very important information. I show you later. And another way, it's a non-enzymatic pathway. And we can get nitric monoxide in photolysis reaction from the high nitrogen oxides, such nitrites and nitrates. And I love this, actually, I love this picture because it shows us that nitric oxide you can find on all cells in other skin. Nitric oxide synthesis control all the cells, all the processes. You can find it in keratinocytes, in melanocytes, fibroblasts, vascular tissue, Langerhans cells, and other. And I just want to show you a research which you can find in PubMed. And this research is very important for us, for people, for practitioners who treat dermatological diseases, because it shows us that this treatment can change a microbiome of other skin. It's amazing. Look, just 24 hours. And I like that I saw Russian guys here in PubMed. I'm waiting for this research of nitrogen plasma. It's very interesting for me. So, my NeoGen treatment experience. Usually, then I view international reports and social media posts about NeoGen. I mostly see results focused on skin rejuvenation. However, NeoGen offers a much broader treatments. In my clinic, my colleagues and I use NeoGen for both aging skin and for the management of various dermatological conditions such acne, rosacea, psoriasis, atopic dermatitis. Additionally, we utilize NeoGen to prepare patients for several surgical procedures and throughout their recovery process. And today, I would like to begin by highlighting some of the results that we have achieved in treating dermatological diseases. So, let's go. First clinical case. I presented last year, and there has been a continuation. This lady with a papulopustular form of rosacea, you see difference between this photo just 2 months and after 2 treatments. I told you that every time I use a wet technique and I use a lot of quantity of pulses. So every time it nearly 1,000, sometimes more, but nevertheless. Yeah. Yeah, wet technique, it means that every time on any my treatments I use water. I spray water before the treatment. On all skin condition, I show you all my cases with a wet techniques. Just look at this and the patient has been using Mirvazaderm. I hope you know what is it for an extended period of time, and I withdrew it. And you can see a side effect after this period. And here I just want to show you after first treatment, after the second treatment, after 1 year. What this photo show us? Think about it. Just 2 treatments of NeoGen and 1 year of remission rosacea. Before the treatment, after the 2 treatment, and she returned me and this much. And I decided to perform 1 treatment of NeoGen, and look at her face. Less redness, less swelling, more lifted, open eye effect. I like it. This, yeah. I show you every time before to do a few of shots. I spray a lot of water. Because when we apply a water, we get another molecules, not only nitric monoxide. No, it's just a water. It's just a water. I use just a spray water like a tonic. I just spray water. So this is this lady with atopic dermatitis on the hand and papulopustular form of rosacea. Just 1 treatment of NeoGen for the hand and for the face. And look at the result. Low parameters, 0.8 and 1,000 of pulses. And for the hand, and just 1 treatment. And look, less than 2 weeks. And we got a excellent result. And she sent me a message and just read. My facial skin is clearer, fresher, lighter, glowing, and my hands softer, elastic, smooth, nice. Clinical case 3, very interesting, because then I saw this patient first time. Every time I think, what is it? Is it acne or rosacea? Or is it combination of the diseases? What is it? Okay, I decided to treat this middle result after 1 treatment of NeoGen. You can see less redness, we don't see pumples, less swelling, and I use Visio, which show us a vascular pattern in the skin, and you can see after 2 treatment of NeoGen how change her vessels under the skin. Another side, and it's not only evolution of the skin, it's an evolution of the smile, yes? It's because her skin more glowy, more cleaner, and it's after the 2 treatment, and look at after 2 or 3 weeks between the treatment, between her evolution of the skin. And this clinical case, this patient with a papulopustular form of rosacea after 1 treatment and after 2 treatment. And here is it. This is my favorite clinical case because this patient sent me her photo on social media, and she asked me to help her, and she treat it a lot, and she got rosacea after the COVID. And of course, then I saw before, because she sent me this photo, I thought that it will be nice to use retinoid here. I can get a wonderful result for her, but she said that she tried to use retinoids twice, and she got this. She got nodules on her face. So, and I decided to treat her with a NeoGen before the treatment. And here you can see if I can do how to. This is video. How I can.
Make the video happen on the 3rd box. There we go.
You see that before the treatment, I spray water, and I just do shots. You should remember that then we talk about nitric oxide. When we talk about concentration of the nitric oxide, it can be pro-inflammatory and anti-inflammatory. And if we use a high concentration of nitric oxide, we get a result, good result every time, because we got anti-inflammatory effects. You understand it? It's a reason why every time I use a lot of shots, more than 1,000, for every patient. Of course, this her skin care after 1 treatment of NeoGen, and after I decided to prescribe her azelaic acid and niacinamide cream, and you can see a middle result. Then I decided to add photodynamic therapy. It's not a phototherapy, it's a photodynamic therapy. You can see her face after the 2 treatment. And here's a 2 treatment of NeoGen, and 2 photodynamic therapy. Look at the result. Yes. It's a parallel retinoid. It was systemic retinoids. Before I met her, she told me a story that she used retinoids, and previous doctor treated her with photodynamic therapy. But after 1 month, she got a nodulus, and she decided to cancel retinoids. 2 times she tried to do it. Yes, retinoids, yes.
But if you ever try to make a treatment with oral isotretinoin, for example, with acne indications?
I can use retinoids with a NeoGen, of course, with a low parameters. I can. So, for example, I can prescribe my patient retinoids, and I can do maybe 1 or 3 treatments of NeoGen for the first month or maybe second month, and when just retinoid. Here's interesting case. When I saw this lady, she works in a dry cleaner industry, and I thought, what is it? Is it contact dermatitis? Is it atopic dermatitis? Is it? I decided to treat her with a NeoGen. Before the treatment, you can see her hand. This is video. I don't have a time, but I spray a lot of water. And you can see a result after 1 treatment of NeoGen and less than 2 weeks. This patient with atopic dermatitis on a hand and a face. 3 treatments of NeoGen on her face. This very interesting clinical case, because we treat a lot patient with acne, and here I decided to perform 6 NeoGen treatments. First treatments I use low parameters and do NeoGen and did perform NeoGen twice a month. And when I hide the parameters for work with acne scars, here teenager, of course, then I saw this patient, I thought about retinoids, systemic retinoids, but he's a professional athlete and he doesn't want to use it. Of course, I use it another way. This is combination of the treatment, NeoGen, phototherapy, photodynamic therapy, and cream with adapalene. We treat a lot of patients with psoriasis, 2 treatments of NeoGen on the hand, 4 treatments of NeoGen on abdomen, 1 treatment of NeoGen on the elbow. This patient with first picture with atopic dermatitis after 1 treatment of NeoGen, and this patient with rosacea, 2 treatment of NeoGen. Next part of my presentation, it's a NeoGen with aesthetic face and body surgery. You know this article in PubMed, what we can combine this treatment. So, clinical case 1. This lady after platysmoplasty, circular mass facelift, and you can see her photo before and after surgery. Every time I use 2 treatments when I talk about regeneration of the skin. I think you know what is it. It's a local dynamic massage. It's a ultrasound and NeoGen treatments. Usually, I started work with a patient in this period when plastic surgeon removed a asphalt net, and you can see a lot of Brussels, edema, maturation after the bandage, and you can see here her transformation of the skin from 1st of April until 12th of April. Yeah. This is interesting because you see, below her earlobe, then I perform a NeoGen. I find fistula here. I just decided, what is it, fistula? Yes, it's a hole. It can be a way of injection, systematic, like a sepsis, inside the skin. It can be inflammation after the surgery. It's a danger for other patient, of course. And I decided to perform NeoGen treatment, and she sent me a photo on the next day. So this 1st April and 12th April. The same patient, I just scroll it. So after 1 month after the treatments of NeoGen and local dynamic therapy, you can see how looks her scar. And after 6 months. This is very interesting case because I work with all type of scars. Here she, after 8 months after the plastic surgery, and I saw that her scars is red. It should be that it's inflammation. It can be, maybe it's keloid, maybe it can be pathology in these scars. So I performed 2 combination of treatment, NeoGen and phototherapy, 2 treatments. This is my favorite patient. She removed implants and she did a anterior breast lift, and here's a pure result of NeoGen. 6 treatments of NeoGen during 9 months. And you can see evolution of the scars. So, this patient, after circular SMAS lift, you can see edema near the L lobe, 6 treatments of LDM, 3 treatments of NeoGen. And you can see, after 1 month, I got this result. So, scars around the earlobe, ear. So this is interesting case, because after the plastic surgery, this lady got a necrosis. And we start with NeoGen. And we just sprayed NeoGen under her skin. Not contact, just sprayed. Few treatments, we sprayed NeoGen. Then we use plasma lifting. When we use native collagen, we just put it inside the necrosis. And now she looks like this. It's a scars after upper blepharoplasty, just 1 treatment of NeoGen, 3 treatments of NeoGen. This very interesting case. This man after the shin burns, after the transplantology of the skin from this, and he lives in another city, and I decided to perform combination of the treatment, 2 treatment of NeoGen with a photodynamic therapy, and I did him a cream with lipids and with a plasma therapy. Maybe we can. Okay. Video doesn't work. Okay. Just 1 hour after the treatment. This lady after the femoroplasty, look at her scars. After 1 treatment of NeoGen, And after 9 months, we got this result on her leg. This lady, this patient, after the kicking of horse, after the plastic surgery, she came to us with these scars, and we got some way. We can see here scar, but it's very nice. So, and NeoGen and skin rejuvenation. This is my nurse. I think that NeoGen, the best treatment for the patient with dysplasia. I have a lot of patients with a connective tissue dysplasia. And we know it because we should think about genes. Because then we talk about dysplasia, we think about mutation in a collagen type first and third, but we should remember that NO synthesis, it's a reason of dysplasia. It's a reason why NeoGen is the best treatment for this patient. Here, interesting case, because during 2 years, I combined just 2 treatments, only NeoGen and plasma therapy. But I use a specific type of plasma therapy. It's not just injection of PRP. I use a combination of 5 different types of our property, our own plasma. And look at her skin. You can look at her face. Before the treatment, it's a tight-looking face and transformation of her skin. We talked about, a few days ago, we talked about fat package in our skin. And this combination can help me to get a wonderful, brilliant result with a low, deep, and superficial package, fat package. One treatment of NeoGen on the neck. This lady asked me to prepare her face to daughter's wedding. Here, one treatment of NeoGen, high parameters, plasma therapy, and bilateral lip shape fillers on her lips. Just look at this area. Yeah. This is interesting case because I was focused on her eyes, but I got a brilliant result on her face. I don't know why. Sometimes I don't understand why. But this is result. We see that toned jawline, less redness, less swelling. I like it. This result. This is one treatment of NeoGen around the eyes. This is rehabilitation after the treatment, and as you can see, we use different parameters. For example, for this patient, from 1.8 and 2 joules for the eyes, and 3.2 for the face. And a result. This is combination of the treatment. And of course, I told you that I love combination of the treatment. I use it a lot, and it's like my experiments every time. It's like my experiments. This lady, after 2 babies and flabby skin on her abdomen, stretch marks, and I decided to perform in one treatment, in one session, 2 treatments. First, it was high frequency microneedling, and immediately after that, I use NeoGen. can we switch on video? How to do it? Can you help me? No? Okay. And you can see how many water on the I use. Yes, really, I sprayed a lot of water, and you can see I don't have a result, but I show you later because it was just maybe 10 or 2 weeks, 10 days or 2 weeks ago. I have a photo. Now she's in a rehabilitation. So this is my very brave patient because she gave me to do this experience with her. I decided to do NeoGen on part of her body, and here's without NeoGen. For me, it's very interesting to see what result I can get. I have it in my iPhone because I didn't add it in my presentation because I saw her 3 days ago, and it's fantastic result, really. I should show you. Just ask me. So you see a lot of water on her skin. So I like this picture. It's my favorite, Simon, which you sent me, because for me, NeoGen, it's like a functional training for all processes in other skin and other body. And of course, I'm use NeoGen a lot. This transformation of my skin. It's I'm 40 years old, but I look young. And conclusions, I don't want to say talk about pathogenic ways. I just want to show you this picture because it's Cinderella, it's me, and I have a magic stick which helped me to get a brilliant result. Really, and I'm proud that I am a part of something great, because I can. It's not about, for me, NeoGen. It's not about rejuvenating of the skin. For me, it's about health. It's that I can help a lot of people with any skin conduction. I really excited to help my patient. So that is all.